Hello, everyone, and thank you for taking the time to learn more about Medicare today. My goal in the next 10 minutes is to give you a clear overview of how Medicare works, how it interacts with your employer coverage, and what you need to know when you become Medicare eligible or get closer to retirement. What is Medicare? Medicare is the federal health insurance program primarily for people age 65 and older, though certain younger individuals with disabilities may also qualify. It has different parts. Part A, hospital coverage. This helps pay for inpatient hospital stays, skilled nursing, and some home health care. Part B, medical coverage. This includes doctor visits, outpatient services, durable medical equipment, and preventative care. Part C, also known as Medicare Advantage. This is an alternative way to get Medicare benefits, where a private insurance company provides your coverage instead of original Medicare. You sign over Medicare to the insurance company so they can control care and reduce costs. Part D, prescription drug coverage. This is provided through private insurance companies, not actually hosted by Medicare. Medigap, also called Medicare Supplement Insurance. This is a secondary plan designed to help pay for the costs original Medicare doesn't cover. This way, you can limit your exposure for medical claims without giving up the control you have under original Medicare. What Medicare does not commonly cover. It's important to know what's missing from Medicare. It generally does not cover long-term custodial care, most dental care, vision exams for glasses, hearing aids, or routine foot care. These gaps are often surprising to people transitioning from employer coverage. Medicare typically covers medically necessary claims, though. For example, if it is an eye exam to check in because you have glaucoma, then Medicare will likely cover that visit because it is now a medically necessary visit. Just be careful if your eye doctor also performs the refraction or the exam for your prescription at the same time. That part of the visit may not be covered. What does it take to qualify for Medicare? To qualify, you or your spouse generally need at least 10 years or 40 quarters of work where you paid Medicare taxes. Most people become eligible at age 65. If you meet those requirements, Part A is usually premium-free, though Part B and other parts have costs. What does Medicare cost? Part A, usually free if you or your spouse worked long enough, as previously stated. Part B has a standard monthly premium, which changes each year. In 2025, it is $185 per month for most people. If your income is higher, you may pay more. This is called IRMA, the Income-Related Monthly Adjustment Amount. It's a surcharge applied to Part B and Part D if your income exceeds certain thresholds. Depending on your income, this could bring your cost up to as high as $628.90 per month. Penalties and employer coverage. Many people worry about Medicare penalties. Here's the good news. If you're still working and have health care coverage through your employer, or you're covered under your working spouse's employer plan, you do not face penalties for delaying Medicare. I want to emphasize, this includes spouses, but not domestic partners. That distinction matters and may contradict the rules of your current group plan. When you're still working, while you're actively employed with group coverage, Medicare is optional. You do not have to enroll in Part B right away. Many people choose to take Part A since it's usually free. But if you are contributing to a health savings account, HSA, you need to be careful. Enrolling in Part A automatically disqualifies you from eligibility to contribute in the eyes of the IRS. If you avoid enrolling in Medicare Part A to continue HSA contributions, you must then stop HSA contributions at least 6 months before enrolling in Medicare to avoid tax penalties. This is a critical planning point if you want to continue down the path of the HSA. We highly recommend talking to an account manager at Stevens & Associates to help get more details and direction if you want to do that. Medigap versus Medicare Advantage. When you eventually retire and transition fully to Medicare, you'll have to decide how to structure your coverage. Medigap, or Medicare Supplement, works alongside original Medicare Parts A and B. Covers deductibles, coinsurance, and other costs Medicare doesn't fully pay. Offers stability. Your benefits don't change much year to year. You can see any doctor who accepts Medicare nationwide. The trade-off: premiums tend to increase over time. Medicare Advantage, or Part C. Private insurance companies bundles Parts A, B, and usually D, often lower upfront costs, but often more exposure for high-cost claims. You may face more restrictions, such as provider networks and pre-authorizations. Benefits and provider networks can change on you year after year. At Stevens & Associates, we often recommend Medigap for those who want the most control and consistency over their care, especially as healthcare needs increase with age. That said, Medicare Advantage can make sense for certain people. It's about understanding what is the most appropriate option for you as an individual. The good news is, you don't have to figure all this out alone. Our team takes care of everything for you when it's time to move from employer coverage to Medicare. If you have questions now or down the road, please don't hesitate to reach out to us at info@stevensinsurance.com or by phone at 888-467-4811. Thank you for watching.